Liver cirrhosis. Well, the minute you're diagnosed with liver cirrhosis, everything comes crashing down for you because it is a big disease. It is a very so-called dangerous disease because your liver is failing. Liver is one of the most important vital organ of the body, and of course, the moment you hear that the liver is failing, everything comes crashing down. You're listening to me because you're obviously diagnosed as having liver cirrhosis, or somebody in your family is having liver cirrhosis. Let's not get into why, what is the technicality, why it happens, how does it happen, and all that kind of things. But broadly, you need to understand there are two kinds. One is alcoholic liver cirrhosis, one is non-alcoholic liver cirrhosis. The most important thing that you need to realize here is it is not only people who drink that they get into liver cirrhosis. Now, there are millions of people who drink, every other person in the world drinks, but they don't end up having liver cirrhosis, right? But unfortunately, a person who is diagnosed with liver cirrhosis, if he has 1 peg a day or 2 peg a day, or he has alcohol once in a week, there are people who have once in a month, everybody pounces on them. It is because of your alcohol that you got into liver cirrhosis. That poor man, he would have been having alcohol once in a week, once in 10 days, once in a month, but unfortunately he gets liver cirrhosis and that's it. All the acts fall on him. It's all because of your alcohol, because of your drinking. Blame game starts. As it is, that man has got liver cirrhosis. He doesn't have too many options in life. Adding to that, you are pouncing on him, making him feel guilty for all that alcohol that he's had in his life. Now my question to you is, what about those people who get liver cirrhosis who don't drink? What are you going to tell them? There are people who drink alcohol day in and day out and they don't get liver cirrhosis. What is the answer to that question? There's nothing. So it is just our destiny that some people get into liver cirrhosis. Sometimes a bad liver tendency runs in the family. Anybody can get liver cirrhosis. You could get liver cirrhosis without having alcohol. The first thing is to stop blaming people with liver cirrhosis. They only get worse by that. A negative mind, a sad mind will not let the body recover at all. Very important to make them realize that it's okay that you got liver cirrhosis. Anybody could have liver cirrhosis. It's not because of the drink that you've had. I'm not talking about people who've been drinking 24 hours, got liver cirrhosis. All right, they deserve it. Oh, it's because of that. But most other people are not. Now, most of the people, once they're diagnosed, they go to the doctor. They either have bleeding or they have stomach issues, they vomit blood, they have internal bleeding, they have stomach pain, bloating, stomach issues, all that kind of things, and they go to the doctor. Usually when they start bleeding, they do a surgery and they rectify it. They come back home, they're off alcohol for a week, 10 days time, then they again go back to alcohol, then they again get it. So this keeps happening on and off for this liver cirrhosis patient. They keep going to the hospital, coming back, drinking, going back. You see, what you need to understand here is these people are alcoholics, particularly the ones who are alcoholic liver cirrhosis. And the basic nature of the alcoholic is, I don't mind dying, but I'd like to drink and die. I don't want to stop this thing and live further. That's their basic attitude to life. You cannot change that thing. Whatever you do, it's very difficult to change. There are some people who get scared, they want to leave and they stop alcohol, but they continue to have some problem or the other because their liver is kind of dying. Very difficult to get it back. The other option in allopathy is going for a liver replacement, which is again a huge process legally and financially. It's a big thing to do. Not everybody can go through that process. What can homeopathy do? Well, we've been treating a lot of cases of liver cirrhosis who have approached us, both alcoholic and non-alcoholic, and homeopathy has medicines which has got a very good tendency to cure the liver. Liver is a fantastic organ, mind you. Even if you cut off a liver, it can function. It has got the capability to perform. It is something that can adapt and adopt and perform. So we enhance the liver. Once we are able to enhance the liver, it's able to take over the functions and the LFT levels, they start to come down slowly. Counseling is very important along with the medications. So most people who come to us, we tell them to continue with allopathic medicines. There are not many allopathic medicines except liver tonics and stuff like that. We don't mind them continuing with that and continue with homeopathic medicines. We've had number of patients whom we're treating. We are maintaining. They're doing very well. The episodes of bleeding have come down. The episodes of stomach pain has come down. And no discomfort. They've been able to manage. Some of them with an occasional drink too. We've been able to manage. So if you are diagnosed with liver cirrhosis, contact the homeopathic doctor. he will surely be able to help you. I'm not saying he'll be able to cure you of your liver cirrhosis, but he can keep you alive and fairly well. What would I do if I had liver cirrhosis? Well, if I had non-alcoholic liver cirrhosis, I would definitely take homeopathic medications. Would I go in for a liver transplant and stuff like that? Maybe no. I strongly believe in my destiny. I believe that the number of breath I'm meant to take in this world is already determined. I don't believe that anybody can extend my life. But the quality of life that I want to live is my choice. And I will definitely choose to have a quality life rather than a quantity life. I will take alternative systems, take homeopathy, maybe take some Ayurvedic medicines, get on to yoga, get on to pranayama, get on to meditation. I would enjoy my life and I would keep going as long as I'm meant to go. But I would not go in for any aggressive treatment. That's my opinion, that's my personal perspective. Take care.